So good morning. In the last session, of IMNCI, we discussed about breastfeeding. What are the different problems a mother is facing while she is doing breastfeeding, or what are the problems a child is facing during the breastfeeding. Along with that, we have discussed what are the points of good attachment. Again, I'll revise it. There are four important points which is very important into the good attachment to the breast. The first point is there should be a wide open mouth. The mouth of the baby should be very wide. Second point, the lower lip should be turned outside. Third point, the upper areola should be more visible compared to the lower areola, and the chin should be touched with the breast. These are the 4 points which is very important. Now, in continuation of the same lectures, so if a baby having LBW, so in the same way we are moving for the history collection of that particular child. In the same way, the immunization, because this is one of the very important component. So here we are going to be get the immunization history of the child. So in continuation of the same, firstly we need to identify whether what is the age of the child. According to the age of child, whether we should identify whether the particular dose is given to the child or not. At the time of birth, the BCG vaccine was given to the child or not. Then later on 1.5 month, the DPT, BCG, or whether we can say nowadays pentavalent is also available. So that all the vaccinations are given to the children or not. DPT, basically there are 3 diseases are covered into DPT: diphtheria, pertussis and tetanus. Now on the place of DPT, now in market pentavalent is available. So pentavalent, it is also considered as a mixture of the 5 diseases. It will work against the 5 diseases, same diphtheria, pertussis and tetanus. Then it will be hib, Haemophilus influenza, and then hepatitis B. So these all 5 diseases are covered into pentavalent vaccine. So the pentavalent vaccine is generally given at 1.5 month, 2.5 month and 3.5 month. So it will also consider 6 week, 10 week and 14 week. So when a worker is going to collect the history from the mother or from their parents, so she must ask about the immunization schedule. Firstly, she must look at the infant age on the clinical record. Second, ask the mother if the infant has immunization card or not. If the mother answer yes, then the ASHA worker or the person should ask her to carry the immunization card. Once you will go through the immunization card, you must be understand what are the doses is given, what are the vaccination is already given, and which vaccine is pending. So it will give you another clues whether this vaccine was given on appropriate time or not. Circle any immunization the young infant needs today. So if there is any pending immunization is there, the health worker must circle into that, so that we come to know. Yes, ask the mother to tell you what immunization the infant has received. Then again we can ask the mother for the cross verification whether these all the vaccines are given to the child or not. Give an immunization card to the mother so that she can verify the things. Then in the same continuation, assessing other problems along with immunization. Then we are going to be assess the other problems. In that, all sick young infants need to be assessed for other potential problem mentioned by the mother or observed during the examination. When a health worker is going into the house of this mother, so he or she must examine the other potential problem of the child. So other potential problem means the child suffer with the diarrhea, the child is not able to get a proper breastfeeding, there is a chance convulsions is present into the children's, child is unconscious, or child, we can say the child is lethargy. These all condition must be take care during the visit. The most important component is a referral of the young infants up to the 2 month of age. Because if any disease which is comes into the red color zone, so when red color zone is there, primarily you have to be give the local level treatment, and then we are going to be shift the child to the referral. So when you refer the child, so that time whatever the components are important, that is also take care of that. So some of the points which is very important while the refer, so Noted it. First point, the first step is to give urgent pre-referral treatment. Whatever the basic treatment, we should provide it. Second point, possible pre-referral treatments include first dose of intramuscular or oral antibiotics. Second point, keeping the infant warm, because it is one of the very important component, because if the baby is not able to become warm, so there may be chances of hypothermia. Prevention of hypoglycemia with the breast milk or sugar water. Continuous, a mother should provide breastfeeding, or whether we should provide the sugar water, so that the blood glucose level will not reduced. Frequent sips of ORS solution on the way to the hospital. So this is all very important component when we are going to be refer the child from one point to the another point of time. So I hope you are able to understand it. Now I'm dropping a quiz for the same what we have discussed. Please attend the quiz. Thank you.